Hello, I'm Dr. Manjiri ValsangkarPune, Director, Bhide Hospital Test Tube Baby Center, Navipet, Pune. Today, it is a very valid question of one of my patients which we are discussing. Is low AMH associated with high chances of abortions or miscarriage? And the answer is yes. Now, whenever we know that we have a patient who is having an AMH of less than 1, it means that we are not expecting very high quality M2 oocytes, or maybe we may even land up with no M2 oocytes. So whenever we are doing an IVF cycle for a patient with a very low ovarian reserve, we make it a point to explain to the patient to take an informed decision for self IVF cycle depending on what is the quality and the quantity of the M2 oocytes or the oocytes which can be translated into an embryo by the ICSI technology. Now, this is known that whenever the AMH is very poor, it is also associated with a high number of DNA transcription errors, or there are certain errors which are associated, which might result in a chromosomal aberration as well, which might result in first trimester or abortions in the first 3 months, which means patient conceives. Even if she conceives with a low AMH with IVF, she conceives, she goes ahead but starts bleeding, or the baby is found out in sonography that it has not got the heartbeat, and something like a missed abortion or a blighted ovum. So if you are a patient who is undergoing test tube baby in a very low AMH setting, we know that in spite of giving medicines etc., there are a slightly more risk, around 5 to 7% higher chances of miscarriages, and this has to be known before the patient takes a decision for going with a self IVF cycle in very low AMH settings. Thank you.